Welcome to our webinar. Today we're looking at quality and compliance and the difference it makes when it's being driven by real-time data. Just to give you a very quick introduction, this webinar is to be hosted by myself. I'm the iPlanet Client Director for UK and Ireland. My own background was in social care as a registered manager, regional ops manager and a project consultant. And Lisajane, who is our iPlanet International Client Director. And she has decades of experience in the sector before joining Aspira Co 6-7 years ago. So hopefully we all know what we're talking about, and so that's just a quick introduction. So what we're going to be looking at today is we've looked at a few other elements in previous webinars in terms of service delivery and measuring quality and effectiveness of services from the point of view of a service user, from that frontline service. But today we're going to be looking a bit more into what is quality and how is it measured on a sort of service level. What is compliance? Because there is a distinction between the two. What is continuous improvement? And of course the role of technology within those aspects there. So I think we'll start off with just taking a look at quality. So when you're measuring quality, what you're looking at really are not necessarily intangible, but they're a bit more, it's a bit looser term when you're looking at qualitative measures. So you'll be looking at standards of your service. So that could be external standards, such as the CQC, CLOEs, or or the regional regulators standards that they expect you to meet. Or they could be internal, so you may have your own internal set of standards, whether that's KPIs or whether that's your values and vision. Even they're all how you're measuring the quality of your service delivered to a service user, and also the quality of the service overall. And that can be measured again in terms of its effectiveness. What difference are you making? How are you achieving what you plan to achieve? So that would be that's measuring the outcomes that you're achieving with your service users, and the feedback you get. And that's also, so it's much more perceptive. It's about perception of your service. How do service users feel about the service? How do your staff feel about their role? So when you're looking at quality, it's a quite a loose definition, and there are many ways of collecting that information. So that could be customer feedback, service user feedback, staff feedback, quality questionnaires, your reviews when you review your support plans and things. That feedback, that's an ongoing, it's an ongoing sort of gathering up of data, but it's very hard to sort of define specifically because it's as I said, it's qualitative. So you're looking at how people perceive that, perceive your service and perceive the service that they're receiving. When you're looking at compliance, it's a lot more black and white, and it's much more quantitative. You're looking at things that are set in stone. So they might include your regulators. So as opposed to guidelines and standards, you may actually have specific regulations that you have to adhere to from the CQC or the CIW, CIS, RQIA or HICWA in Ireland. And that things like safeguarding, how you deal with the safeguarding is fairly set in stone, and also you have your local authorities there as well. Events and incident management, how they're managed from a regulatory perspective, and also the staff competencies, the minimum standards that you require your staff to have in terms of training and approach and character are all set out. It's not, whereas with quality you're looking at perception. With compliance you're looking a lot more at yes or no. Basically it's a you did or you didn't. Did you resolve this safeguarding in the time frame that's set out? Did you have all of your staff got their DVS checks and the relevant training to be working with the service users that they are? It's yes or no answers. You may also have contractual compliance, so that will come from local authorities or NHS or the HSE in Ireland, where you're looking at these are set in a contract, things you have to achieve and things you have to evidence. And also, we've looked, as I said, we've looked before at how we look at quality and how we look at monitoring on a service user level, but also you have other legislation at a service provider level, whether it's a location or whether it's the service as a whole. And so, types of legislation you have to think about with things like health and safety, and your RIDDOR and COSH, which should have some connection there. And also you have regulations around your building and your equipment. So these aren't necessarily related to the service that you're delivering to an individual, but this is about how your service fits in on a wider level with other legislation. So that might be your lifting operating testing for your lifting operating machinery, your hoists, pack testing, building regulations, Legionnaires testing in your aircon systems, or the health and safety checks you have to do every week. And also, whereas on a quality level, you need your staff to be trained to a certain level, and you want your staff to be engaged, and those sort of personality traits which are very hard to define, there are some things you have to do from an employment perspective as well. So the difference, so the main difference is compliance is quite black and white and is normally legislated for, whereas quality is normally a guide, a set of standards that you're working to, whether they're internal or external. But both quality and compliance feed into a culture of continuous improvement that social care providers embrace and look to constantly improve on what they're doing and resolve those issues. And continuous improvement generally is an ongoing process, and it's a cyclical process. So you'll plan out how you're going to deliver your service, whether on an individual level or a strategic level. You deliver those services, you record what you've delivered, you then monitor as you're going and also in retrospect, and then you review those findings to help you plan for the next stage. And that sort of cycle, that's a very simplified version. There are different versions, and there's a lot of work goes into all of those. It's very easy to put it down into 5 circles there. But as a general overview, that's a sort of cycle that most providers will look at. So in terms of what that really looks like in terms of those measurements, when you're delivering and recording service, they're basically your inputs. In terms of continuous improvement, you're recording what you've done, the inputs that you've made, the service delivery that you've done, or recording events that have happened, and then how you monitor those and how you review those are the outputs. So that's the information that you take out, which then helps you to plan and start the cycle again. Now, where with traditional paper-based systems or legacy digital systems, which are form-based, the level of data that goes in will be reflecting the level of data that goes out. So what we want to look at now is the role of technology in that as we move forward. And I think this year, in fact, the whole year has shown us that social care sector needs to be looking at new ways of doing some of this and better ways of doing this. So technology really comes into play. So when you're looking at quality, the technology, you've got real-time monitoring. You're not relying on bits of paper or forms to be filled in and collected. You can digitize the complaints and compliments processes. You have satisfaction surveys where you can feed that data back in, and of course it's communicating all of this as well. Communication is key, and technology is one of the biggest areas it improves is communication. And on your compliance side, technology, digital systems can manage your incident management workflow. It's not a piece of paper and a file that gets passed around. It's a workflow. It's alive and dynamic, and you record the incident, you start investigating, and you record those investigations, and you look at outcomes and look at lessons learned, and also it makes it a lot easier for escalating those incidents or events, whatever they may be, or safeguarding or an accident. Technology also provides really in-depth audit trail, so you can really look at what you've done to resolve these issues a lot better than traditional legacy systems. You can also use technology for scheduling those location tasks that we talked about, such the health and safety checks and the things that have to be done, and you have to be alerted to make sure that they're done, and then you have to record that they're done. And again, it's communication. It's being able to resolve these compliance issues as a group, as a team, and also being able to feed those lessons learned back out to the wider service. And all of that feeds into continuous improvement. And what it comes down to is data. Technology, the role of technology in all of this is that the level of data and information that you can gather whilst you're doing it, those inputs when you're delivering and monitoring, when you're delivering services, those inputs that go in, the records that you keep, really, you get such a much higher level of detail coming back out again. So, it can come out whether it's a form of a report, or whether you're just drilling down into an audit, and that can really support things like root cause analysis and trend identification. So if you're looking at, say, incidents over the past 6 months, you can drill down and you can see if there's a trend, a number of similar incidents at a particular location, maybe an issue at that location. If it's company-wide, then you're probably looking at something more systemic. And on an individual incident basis or an individual event, you have that root cause analysis, that level of data. You can say, why did this happen? And you can ask your why questions and go backwards until you get to the right at the beginning. It may be, the event may be that someone missed their meal time and they were diabetic. The root cause may be that there were roadworks right near where they live, and the support worker was late getting there. It could be as simple as that, or it could be much bigger, a much more complex situation. But that data is there to evidence that and support your investigation, and then to help you plan for the next stage, and continuously improve. And that's what everyone in social care is really looking for on a service level. So in terms of iPlanet, and how that fits into that sort of technological advances that we're making in quality and compliance management. We've looked previously at different modules and how we support people on the ground, how service users' lives are impacted. But today I'm just going to hand over to Lisajane, and on the looking at more service level quality and service level compliance, we're going to be looking at the location management and the event and incident management modules. And just to give you a little taste of the impact that iPlanet can have and how that can support services in that continuous improvement ethos.